On behalf of the Patient Safety Authority, I would like to welcome you to the webinar titled COVID-19 and Childcare Infection Prevention Strategies. My name is Jeff Bomboy and I will be your moderator for this program. I'd like to introduce our speaker for the webinar. JoAnn Adkins is a registered nurse and senior infection preventionist for the Patient Safety Authority. In her role at the authority, she works with Pennsylvania healthcare facilities to improve patient safety through infection prevention initiatives. Ms. Adkins has presented educational programs on infection prevention topics at the local, state, and national levels. Ms. Adkins is a board-certified in infection control and epidemiology and is a fellow of the Association for Professionals in Infection Control and Epidemiology. Ms. Adkins is a 2019 recipient of APIC's Heroes of Infection Prevention Award for Education. She is a member of the Association for Professionals in Infection Control and Prevention, the Sigma Theta Tau International Nursing Honor Society, and the Pennsylvania Association of Directors of Nursing Administration Long-Term Care, and Central Pennsylvania Association of Healthcare Quality. So I'd like to tell you what our objectives are today, and then I'll hand the program over to JoAnn. Our objectives are to describe everyday preventive actions staff can take to help prevent the spread of COVID-19, list 3 safe methods of screening children for symptoms, discuss the importance of hand hygiene and when to perform hand hygiene. JoAnn is very well versed in these infection control topics, and I'll send the presentation over to JoAnn. JoAnn?
I wanted to make you all aware that Jeff and I teamed up to do this presentation. He did background research, and then I polished and am doing the presenting. So this is a team effort. So no matter what level of transmission is present of COVID in a community, every child care program should have a plan in place to protect staff, children, and their families from the spread. On this slide is the link to the CDC webpage for guidance for child care facilities that you may want to keep to refer back to. So one thing the guidance says is it is important to plan ahead. The components of a facility infection prevention plan include everyday preventative actions, requiring sick children and staff to stay home, and how to clean and disinfect your facility. So we're going to discuss them in further. Everyday preventative actions. Wash your hands often with soap and water. If soap and water is not available, then use an alcohol-based hand sanitizer, but read the label. It should contain at least 60% alcohol to effectively kill the germs on your hands. You need to clean and disinfect frequently touched surfaces. Cover coughs and sneezes. Always sneeze or cough into your elbow or into a tissue, not into your bare hand. And then always wash your hands or use hand sanitizer after coughing and sneezing. And then cover your face, your mouth and nose. It's important to cover your mouth and nose as much as possible within the facility. And also remember, when you are at home and go out into the community, always cover your mouth and nose to protect others. But remember, cloth face coverings should never be put on babies or children under 2 years of age because of the danger of suffocation. If the child is not able to remove the mask by themselves, they should not have a mask on. Hand washing. This poster that's on this slide is available on the CDC website for you to print out and use within your facility. But hand hygiene is the most important measure you can use to prevent the spread of infection. Wash your hands often with soap and water, and wash for the amount of time it takes to sing happy birthday twice. If soap and water are not readily available, then use an alcohol-based hand sanitizer containing at least 60% alcohol. If your hands are visibly dirty, then you must wash with soap and water to remove that dirt. Because if the dirt is not removed, alcohol gel, the alcohol cannot get underneath the dirt to kill the germs. If you are allowing young children to use hand sanitizer, please supervise them. It does contain 60% alcohol, so make sure they do not swallow it or lick their hands if they're very young. So when are key times to wash? After blowing your nose, coughing, or sneezing, after using the restroom, before eating or preparing food, after contact with animals or pets, and before and after providing care to another person who needs assistance, such as the children in your child care facility. So what is the correct way to wash? Well, I just want to review that with you. If you are washing with soap and water, you want to wet your hands with warm water, not hot. If you use hot water, it dries your skin and can cause tiny cracks in your skin, which is an easy place for germs to enter and cause infection. So wet your hands with warm water, apply soap, and then lather your hands and scrub briskly for 20 seconds. Like I said, we teach children to sing the happy birthday song twice. When you're scrubbing, make sure you scrub the back of your hands, around your wrists, between your fingers, palms, and your fingernails. Then rinse your hands well with warm running water and dry with a paper towel. Use that paper towel to turn off the faucet. If you turn off the faucet with your bare hands, then you've picked up all the germs that you put on the faucet handles prior to washing, plus the germs of other people who washed their hands before you. If you're using an alcohol hand sanitizer, an alcohol-based hand rub, apply about a quarter-size amount to the palm of your hand, and then rub your hands briskly together and make sure you rub all areas of your hands, the back of your hands, between your fingers, the palms of your hands, and you continue rubbing till your hands are dry. Do not dry your hands with a paper towel. You rub until the alcohol gel is dry on your hands. Stay home if sick. Require staff and children who are sick to stay home. And for this to occur, communication and education is vital. Communicate to parents the importance of keeping children home when they are sick so they do not spread the illness to other children. And communicate to your staff the importance of watching for symptoms of COVID-19 or other illness and notifying management if or when they start to feel ill. Make sure you establish procedures to ensure that children and staff who come to the center, either sick or become sick while at the facility, are sent home as soon as possible. Keep sick children and staff separate from well children and staff until they can be sent home. And sick staff members should not return to work until cleared. So plan ahead if somebody becomes sick within your facility. Plan to have an isolation area or a room. An area could be a cot placed in a corner of a classroom that can be used to isolate a sick child. Be ready to follow the CDC guidance on cleaning and disinfecting your building or facility if someone's sick. If a sick child has been isolated in your facility, clean and disinfect the surfaces in that isolation area after they have gone home. If COVID-19 is confirmed in a child or a staff member, then CDC recommends closing off areas used by the person who is sick. Open outside doors and windows to increase air circulation in those areas and air them out. Wait up to 24 hours or as long as possible before you clean and disinfect. The reason for that is to allow respiratory droplets that carry the virus to settle to the floor before cleaning and disinfecting, so you're sure that you remove them. And then also clean and disinfect all areas used by the person who's sick, such as offices, common areas, bathrooms. For cleaning and disinfecting in your facility, use an EPA-registered household disinfectant and make sure you're following the instructions on the label for safe use. Many products recommend what we call a contact time, and that's the amount of time you should keep the surface wet to disinfect, and that should be listed on the label. Also, follow precautions such as wearing gloves and having good ventilation during use of the product. Diluted household bleach solutions may also be used. They will be an adequate disinfectant. However, color-safe bleaches or whitening agents may not provide adequate disinfectant because they don't have the hypochloric acid. Unexpired household bleach will be effective against coronaviruses such as COVID-19 when properly diluted. Always follow the manufacturer's instructions for application and ventilation, and never ever mix bleach with ammonia or any other cleanser. The contact time for bleach is 1 minute. You leave the solution on the surface for at least 1 minute. When you go to clean and disinfect, wear disposable gloves. But before you ever put gloves on, always wash your hands first. Average adult hand carries thousands and thousands of germs prior to being washed or doing hand hygiene. If you put those unwashed hands into a glove, you have put all those germs in the perfect incubator because it's warm, it's moist, and it's dark, and they will multiply. So clean your hands and then put on disposable gloves. Clean surfaces first with soap and water to remove the dirt, and then disinfect them. If the dirt is not removed first, the disinfectant doesn't reach the germs to kill them. Plus, cleaning with soap and water reduces the number of germs, dirt, and impurities on the surface you're going to clean. And then following with disinfecting will kill the germs. Routinely clean high-touch areas. And high-touch surfaces include your tables, your doorknobs, light switches, countertops, sinks, toys, those sort of things. Here's the recipe to make a bleach solution as a disinfectant. It is 1/3 cup bleach in a gallon of water, or 4 teaspoons of bleach in a quart of water. This solution is effective for up to 24 hours. Chlorine will evaporate, so you must make this solution up fresh every day. The CDC also states that alcohol solutions with at least 70% alcohol may also be used. When it comes to cleaning soft surfaces such as your carpeting, rugs, or drapes, clean the surface with soap and water or cleaners that are appropriate for use on them. Launder them if possible, according to manufacturer instructions. And when you launder them, use the warmest water possible and dry completely. Or disinfect the surface with an EPA-registered household disinfectant and then vacuum as usual. When it comes to clothing, towels, or other items, all laundry is considered contaminated with germs. So you need to protect yourself. Launder the items according to manufacturer's instruction in the warmest water possible and dry in a hot dryer. Always wear disposable gloves when handling dirty laundry from a person who is sick to protect yourself. But dirty laundry from someone who's sick can be washed with other people's items because it's all considered contaminated. Do not ever shake dirty laundry because you will what we call aerosolize or throw those germs up into the air where they can either be breathed in or settle on other surfaces. After you put the dirty laundry in the washer, remember to clean and disinfect your hamper. And then remove your gloves and wash your hands right away. For cleaning and disinfecting your outdoor areas, Remember, ultraviolet light is a very strong disinfectant, and we get that from the sun. Outdoor areas like playgrounds and parks require normal routine cleaning but do not require disinfection. Do not spray disinfectant on outdoor playgrounds. It's not an efficient use of your supply, and it's not proven to reduce the risk of COVID-19. However, high-touch surfaces that are made of plastic and metal, such as grab bars or railings, should be cleaned routinely because sticky fingers can leave dirt on those surfaces and then germs will adhere to that sticky surface. Wooden surfaces, such as benches, tables, or ground covers like mulch or sand, is not recommended for disinfection or cleaning. And sidewalks and roads should not be disinfected as the spread of COVID-19 from these surfaces is very low and disinfection is not effective. But I want to speak specifically about toys. Toys that cannot be cleaned and sanitized should not be used. And this is the time to not allow toys to be brought in from home because you do not know how they are being cleaned. Toys that children have placed in their mouths or that are contaminated by body secretions should be set aside until they are cleaned by a person wearing gloves. Clean them with water and detergent, rinse them, and then sanitize them with an EPA-registered disinfectant. Rinse again and allow them to air dry. Or they can be washed in a dishwasher. And always be mindful of items that children are likely to put in their mouths, such as play food, dishes, and utensils. Machine washable cloth toys should be used by one child at a time and then laundered, or should not be used at all. If you can't clean them in between children, then do not have them available. Do not share toys with other groups of infants or toddlers unless they are washed and sanitized before being moved from one group to another. Toys that need to be cleaned that are dirty need to be placed in a separate container, preferably covered, and marked soiled toys. The ideal method to clean these toys is to then wash them with soapy water. But try to have enough toys so that the toys can be rotated through cleanings. What I have set up in my church is we use a 5-gallon bucket from either one of the Home Depots or Lowe's that has a lid. The dirty toys go in that bucket and the lid is secured on top. That prevents other children from inadvertently picking up a dirty toy. Social distancing strategies. Some of the recommendations from the CDC for social distancing is childcare classes should be the same group each day, and the same childcare providers should remain with that group each day. If you have many children of healthcare workers or first responders, you may want to consider creating a separate group or classroom for them, as they are frontline staff that may be exposed to COVID. This is the time to cancel or postpone special events such as field trips, holiday parties, or festivals. They also recommend limiting the mixing of children, and ways to do that are by staggering playground times, keeping groups separate for special activities such as art or music, and at nap time, space out their mats or cribs as far as possible, at least 6 feet if possible, and consider placing the children head to toe in order to further reduce the potential for spread. You may want to also consider staggering arrival and drop-off times of children, and/or have child care providers come outside the facilities to pick up the children as they arrive. I call this curbside drop-off and pickup. If you plan for curbside drop-off and pickup, limit the direct contact between parents and staff members by adhering to the social distancing recommendations. Diapering. This picture that's on this slide is also a poster you can print out from the CDC website, and I have those links at the end of this presentation. But when diapering a child, always wash your hands and then wash the child's hands before you begin and put on gloves. Safe diapering procedures are to wash your hands and put on the gloves, remove the soiled diaper, clean the child, dispose of the soiled diapers and wipes, replace the diaper, wash the child's hands, clean up the diapering station, and then wash your hands. And those steps are listed on this poster. Even if you were wearing your gloves, you need to disinfect the diapering area and wash your hands, because taking off the gloves, it's possible to pick up germs that were on the gloves themselves. When it comes to washing, feeding, and cuddling children, it is important to comfort and cuddle crying, sad, or anxious infants and toddlers, and they often need to be held for that. So cuddle carefully. If you are holding an infant, turn their face, or a toddler, turn their face away from yours towards your shoulder to help get a little bit of separation between yourself and the child's face. Protect yourself by wearing an overlarge, button-down, long-sleeve shirt, and if you have long hair, pull it up off your collar so the children are not grabbing your hair with their dirty hands. What we use in my church is we went to a thrift store and bought men's double and triple X long-sleeve button-down dress shirts that are easy to launder, and that's what our child care people wear. If the child touches your neck or your face or your hands with their hands that have their secretions on them, either their runny nose or were crying, make sure you wash those areas, anywhere that have been in contact with their secretions. If a child's clothing are soiled by secretions, change it. If the button-down shirt you're wearing has secretions on it, take it off, put it in the laundry, and wash your hands. And then put another shirt on. Contaminated clothing, if it's being sent home for a child, should be placed in a plastic bag and tied shut, or washed in a washing machine immediately. There should be multiple changes of clothing on hand at your facility for the children and their providers. When it comes to bottles, child care providers should wash their hands before and after handling the bottle. And bottles, bottle caps, nipples, and other equipment used for bottle feeding should be thoroughly cleaned and washed with soap and water, or washed in the dishwasher after each use. Food preparation. If you normally do group dining, this is the time to separate it out and serve the meals in the classrooms. If you normally do family-style meals, do not do that now. Plate each child's meal so that multiple children are not touching the same utensils. The food preparation person should not also be diapering children. The sinks used for food preparation should not be used for any other purposes. Caregivers should ensure children wash their hands prior to and immediately after eating, and the caregivers should wash their hands before preparing food and after helping children eat. The symptoms of COVID-19 are the same, for the most part, between children and adults. Based on the available evidence, children do not appear to be at higher risk for COVID-19 than adults. And while children and infants have been sick, adults make up most of the known cases so far. Children with confirmed COVID-19 have shown symptoms such as fever, runny nose, cough, and they may also have vomiting and diarrhea. Children with underlying medical conditions and special health care needs may be at higher risk for severe illness. So we need to screen healthcare, our facility workers, our child care workers, and the children for COVID-19. So what we do is you assess for a fever greater than 100.4. You look for symptoms such as fever, vomiting, diarrhea, coughing, difficulty breathing, or sore throat, and query the parents if the child has been in contact with somebody who is positive or suspected of COVID-19 within the past 14 days. There are 3 safe screening methods for staff. The first is social distancing, and that's where you ask parents to take the child's temperature before coming to the facility or upon arrival. And the parents also confirm that the child does not have symptoms. And then the child care worker makes a visual inspection of the child for symptoms. This is done maintaining a distance of 6 feet. If you can't maintain that separation, then you need to wear protective equipment. Another safe screening method is a barrier or partition. The staff member stands behind this barrier, and you want to protect what we call the T-zone, which is your eyes, your nose, and your mouth, which is lined with mucous membranes. This staff member takes the child's temp by reaching around this barrier and inspects the child for signs or symptoms, but always keeps their face behind the partition at all times. And then the third method is personal protective equipment if you're within 6 feet of the child, but that's less effective control and more difficult to implement because of shortages with personal protective equipment and the trainings that's required to wear some of it safely. This is your resource page I told you. They has links to what I think will be valuable information for you. The top 2 are the posters for hand hygiene or diapering, and you can print them out. They are shared governance. There is no charge for that. There is a link here to a really nice article about talking to children about COVID-19. And then the bottom 2 links are the CDC guidance for child care facilities. So what question do you have?
Thanks, JoAnn. That concludes the slide presentation of our program. Now we would like to begin our question and answer period. If you have questions, please type them in the Q&A box found at the bottom of your screen. By hovering at the bottom of your screen, you will see 3 dots. Click the dots to open the Q&A panel and direct your questions to all panelists, and we will try to answer as many questions as we can. And we do have a couple of questions. The first is some child care centers and preschools do not allow alcohol-based sanitizer. Do you have recommendations for non-alcohol-based sanitizers?
Then they would wash the child's hands with soap and water. Recommendations are either alcohol-based hand sanitizers or a regular hand wash with soap and water.
Okay, next question is, what if a child is sick and they have siblings? Do they also get sent home?
If the child is showing symptoms of COVID-19, then chances are the siblings have also been exposed. We don't know without testing if that's what they truly have, but I would err on the side of caution and send them home.
Okay, our next question is regarding safe screening methods on slide 25. Are you recommending screening before entry into the care center or school with questions and temperature checks?
If screening is done by social distancing, ideally the parents would take the temperature prior to the child coming, but the barrier partition control should be right at the entrance to the facility. It could be right inside the door, but the screening should be done. The children should not go back to their group rooms or their classrooms without being screened.
Okay, and a final question I see right now is, what type of protection will you have to use for working 9 hours or 8 hours?
We're talking within a child care facility.
I assume so, yes.
Yeah. It would be a cloth face covering as much as possible. Now, we realize when the worker is eating, they would be in a separate room and not around the children. So, of course, mask would not be on. And if they're going to be in very, very close contact with those children where there's the chance of getting secretions from them laughing, coughing, sneezing, then I would put one of those large button-down shirts on.
If the center doesn't have enough cleaning supplies or PPE equipment, should they still open?
That would be up to the center. If you do not have a way to clean and disinfect, or you do not have a way to protect your workers with PPE, then I do not think it would be prudent to open.
Okay. What about if a child does not have a fever but has symptoms like a runny nose? Do they still need to accept the child?
That would be what they would have to determine within your facility. This is when communication is important. We know that we're going into allergy season, so there's going to be a lot of people with runny nose. That's when I would look, in addition to the runny nose, does the child look ill? Are they having a cough? Are they having the fever? This is when you set up your plan and your policies and communicate to the parents or the guardians what you consider to be the signs and symptoms that would exclude the child from being within your facility.
Is it recommended for children to bring their lunches into the facility, or should they make food on site at the facility if they have the capabilities?
Nothing in the guidance addresses that. If the children are bringing food in from the outside, then realize the containers themselves may be considered contaminated and need to be wiped off before they're placed within your kitchen or your refrigerator or wherever you store them.
Okay. If a child or staff has symptoms concurrent with COVID-19 and is removed immediately, does the entire class have to be sent home?
No, but the parents need to be notified that this child was sent home with symptoms so that they can then observe their children for any signs or symptoms.
If a staff person is taking temperatures, is a plastic face shield enough of a barrier?
That a plastic face shield would protect their eyes, their nose, their mouth, their mucous membranes. Yes, if it's a full face shield would be a barrier.
Do you recommend shortening of the hours of care and the number of children?
That I can't make a recommendation on. That's beyond what I as an IP feel comfortable making a recommendation on. That would be something I think the facility themselves would have to determine.
Okay, the next question is define routinely for toy cleaning. Is this daily?
Yes. Routinely is daily, and if it is something that the child is going to be either contaminating with their hands because they had their hands in their mouth and touched that object, or they had that object in their mouth, then that needs to be cleaned between children. The big equipment that I know is outside that you're not cleaning continually then needs to be cleaned daily, the high-touch areas. But the toys that the children are playing with very closely need to be cleaned between children, as we had on that slide, especially if it's something that gets put in mouths or their hands are in their mouths and then their secretions are going on that toy. That needs to be done between children.
Next question is any regulatory body inspecting child care centers and schools for compliance for these measures and interventions that we have presented?
Not that I am aware of. The people of the licensed facilities would know better than I do how often they're inspected. What Jeff and I were presenting were the guidelines as put out by the CDC, their recommendations for a safe environment within a child care setting. But I do not know if there is a regulatory body that inspects that or not.
And next question, do toys need to be submerged in soap and water?
It says they should be cleaned with soap and water. They should be scrubbed well and then rinsed well. I'm guessing they're talking about a toy that may have batteries or electronics. I would make sure that toy is washed well and then disinfected.
The next question is, what is the privacy concerns with sharing information related to suspected and confirmed COVID-19 cases in facilities for staff and students for parents of children to limit transmission and exposure to the greater population?
If you have a child who was sent home ill, then it would be prudent to let other parents know that there was a child that went home ill. You do not know yet, and you're not relaying by HIPAA concerns what that illness was. Same as in a hospital, when we put an isolation sign up, the sign does not list what illness the person has, it just lists what the precautions are. If someone comes back positive for COVID, then the Department of Health would be notified and they would assist with the contact tracing.
Okay, our next question, would preschoolers be asked to wear masks while in care?
As much as possible, that is what the guidance is saying. But no child under the age of 2 because of the danger of suffocation. Now, we know you're not going to be able to keep a mask on a preschooler at all times. But they are saying that masking should be done as much as possible.
Are the child care centers will they provide test kits to child care centers to the staff, and when and how often should the staff be tested?
I have not heard any information on that from the Department of Health. The guidance I have received so far is not showing any information on that. That may be something the child care facility wants to check with the state.
Okay, our next question, what do we do outdoors when children are touching sticks and stones, etc., in the yard?
It's the same as I said about the playgrounds. UV is a very strong disinfectant. Make sure when they're coming back in from outside, they're washing their hands well. You're certainly not going to be able to disinfect your yard or sandbox or anything like that. So they need to wash their hands well when they come back in before they touch anything. But you would not be able to disinfect that thing. That's when you depend on the UV light from the sun.
Our next question, would you recommend cleaning and disinfecting any toy when used by a single child, whether in mouth or not?
I personally would disinfect it because children are little germ factories. They carry lots of germs, and they can transmit it from one child to another on that toy. So if possible, yes, I would disinfect them. Now, depending on the size of your child care facility, trying to keep track of everything that a very active 4-year-old picked up may be very difficult.
Okay, for those children 3 and younger without the language and social cues, as is recommended to limit their reentry into the center or trickled in, as they are more difficult to manage that population. For those children 3 and younger without the language and social cues, is it recommended to limit their reentry into the center or trickled in, as they are more difficult to manage that population?
Oh, if they're coming in from like outside playing, I'm assuming. And instead of having them coming in mass, one of the things they recommended for entry is we want to try to maintain social distancing as much as possible, which is 6 feet. So you would want to try to trickle them into the facility to try to maintain that distancing.
says often children are assigned snack day where parents bring in unopened store-bought snacks for the class. Is this practice still acceptable?
Like I said, you would have to remember that the outside container is considered contaminated. If that is a practice you're going to continue, I would have it brought into the facility and placed into some type of tote or container right at the entranceway. Then a staff member with gloves could take it out of that original packing container and put it into something clean, be it a bag, on a tray, whatever, and take it to your kitchen and then dispose of that outside container.
To stay up to date on all educational videos from the Patient Safety Authority, please subscribe to your YouTube channel at www.youtube.com/user/Patient Safety Authority. I think our final question is, preschool classrooms may have up to 20 children enrolled. 6 feet social distancing during center play or walking to and from playground seems impossible.
Like I said, you try to maintain social distancing as much as possible. Make sure that if you cannot maintain that social distancing, that they're masked, because they would be an age group that could be masked, and make sure they're doing frequent hand hygiene.
Okay, I see no more questions at this time. I want to thank everyone for joining us today. Lots of good questions. Again, the presentation will be available on our YouTube webpage in a few weeks. This concludes our webinar, and we again thank you for listening to our webinar today.